Carrying another living being inside of your body is no small feat, so it's totally understandable to feel on edge about it or to worry about a miscarriage. While sometimes women can experience recurrent miscarriages, 2 or more consecutive pregnancy losses, a condition that needs to be checked out. Still, that reassurance can only go so far, especially when faced with any twinge, bleeding or cramping during pregnancy. If you're worried at all, certainly reach out to your doctor who can tell you if you need to be examined. And just because you notice some of these signs of early miscarriage doesn't mean there's anything wrong either. Here are the early miscarriage symptoms you should look out for when you are expecting. You are bleeding pretty heavily. While yes, bleeding is a sign of a miscarriage, it depends on what kind of bleeding you are experiencing. Spotting, for example, might be completely normal. As the fertilized egg burrows or implants into the uterus, you may see some spotting. You can also experience bleeding behind the developing placenta. If the pregnancy continues after some bleeding, it can be called a threatened miscarriage and needs to be monitored. Number 2. You are seeing very large blood clots and tissue. While some bleeding and spotting might be normal during pregnancy, clotting of any kind should trigger you to call your OB/GYN. Some clots can even grow to be as big as a lemon for Planned Parenthood. Your body may also pass other tissue or a light pink vaginal fluid. Either way, if you are pregnant and you notice something off with what's coming out of your vagina, it's time to see a doctor. Number 3. You have pain and cramping like PMS. When it comes to cramping, menstrual-like cramps can be totally normal as your uterus begins to expand, says Gaidar. Other times, cramping can be a sign of an early miscarriage. The cramping is from the uterus contracting, trying to expel the pregnancy, says Gaidar. Bleeding and cramping might also be signs of other pregnancy problems, like ectopic pregnancies. So if you are experiencing bleeding and cramping after learning you are pregnant, it's good to get checked out regardless. Number 4. Your back is killing you. Just like cramping, you may also feel a lower backache that can range from mild to severe discomfort. Though again, this can be normal in a healthy pregnancy too. The best advice is boring but true. Always talk to your doctor if you are concerned about your symptoms. They are there to help you in every way they can. Number 5. Your OB/GYN doesn't find a heartbeat. To be fair, this isn't a symptom, but that's because sometimes there aren't any symptoms with a miscarriage. It may also be as simple as not feeling pregnant anymore, according to Planned Parenthood. In other situations, women can have a non-viable pregnancy. You may hear women also call it a missed miscarriage. It happens when a pregnancy fails to progress, especially in the first trimester. You may notice that symptoms you felt before, nausea, for instance, have disappeared, though these may not go away until hormones levels have decreased, says Gaidar. Number 6. You are late. If your period usually comes like clockwork but arrives a little late this time and you've been having unprotected sex, you may have experienced a chemical pregnancy. This usually happens without you even knowing about it, unless you're trying and you take a pregnancy test.